Well, let's move on to the next bit that we're going to be discussing, having to do with multidimensional poverty in Ghana. Per the latest UNDP report, that we have 8 million of our population mired, another 6 million likely to fall into that sinkhole. Well, Dr. John Osai-Kwapong, a CDD fellow, stays with us on that conversation. We also have joining the conversation Executive Director, Center for Development Initiatives and Vice President, Ghana Association of Social Workers, Dr. Saad Idrisu, an economist, also joins the conversation. Good morning, gentlemen. Dr. Idrisu, if you can hear me, good morning. So let me start off with you, Dr. Osai-Kwapong, on this beat. I'm sure you've seen that latest, very troubling report, globally, of course, but when you narrow it down to our perspective and what it says about multidimensional poverty, what the Ghana Statistical Service has been saying about what is your reading of the situation?
Yes, very challenging, especially too because one of the key goals of the whole Sustainable Development Goals really does focus on poverty and challenging countries to really strive towards reducing to a great extent the incidence of poverty. If you look at the regional breakdown, you do see that there's quite a heavy concentration of poverty, in the sub-Saharan African region. And then, of course, as you just mentioned, the numbers that are showing up for the incidence of poverty in a place like Ghana. Plus, the report also shows that one of the things, or one of the ways in which poverty manifests itself is it's also a rural thing. So you find concentration of poverty more in the rural areas than you would in other areas. It doesn't mean that the urban areas do not have their own challenges with poverty as well. I think most of the time I've noticed that in conversations around poverty, we don't tend to talk much about the urban poor. And that's particularly because we tend to see high incidence of poverty in rural areas. We tend to not talk about the urban poor, but urban areas do also have their own challenges with poverty. I probed, further into the report just to look at the most recent year of data that has been used. And I noticed that for Ghana, for the three sources of data used, one is from 2011, one is from 2014, and another is from 2017, 2018. So there's a bit of a time lag in that. And so one of the things that I looked at was to also go to the Afrobarometer survey, because they have some questions on deprivation in 5 key areas: food, water, medical care, cooking fuel, and cash income. And so when you construct or the constructed lived poverty index from the Afrobarometer survey does show that we have about almost 9% who have high lived poverty, and another 25% who have moderate lived poverty, as per the most recent results. And then you see some changes over time. But the key red flag area from the Afrobarometer, when you measure poverty from the dimension of lack of cash income, is the biggest thing that we face. So those are my initial observations about the report.
Now, if you look at the 8 million that have fallen into multidimensional poverty, you're looking at 25.9%, so roughly 26% of our population, because it's 25.97 per my calculations. So 26% of our population that supposedly has fallen into multidimensional poverty on different levels of the poverty scale or the scheme. Now, you also look, while you make mention of the references to 2011 and 2014, which are pretty far away, you would also realize that the Ghana Statistical Service itself, over the last many months has also been speaking about multidimensional poverty on the back of COVID-19 and the Russo-Ukrainian war. What does this mean in real terms to you on the back of the economic crises that we have faced and the reality on the ground? Should we look at something beyond these numbers?
I think we have to look at our economic, but more importantly, we need to look at our social policies that are designed to meet the needs of the most vulnerable in society, right? So whether it's in the area of education, and not just at the secondary level, but also at the primary level, the things that contributes to, because if you look at the latest UNDP report, one of the dimensions they look at in terms of poverty on the education side is the years of schooling, for example. And so we need to examine what our educational policies and practices are. What is it that is contributing to the fact that maybe some are able to have longer years of schooling than other people? What are the barriers and what is contributing to that? If you look at the social dimension of poverty, things like access to healthcare, what is it about the access to healthcare in terms of our policies, practices, that is not allowing, that is not allowing us to really make the kind of strides that we want to make in addressing issues of poverty. We have cash income programs like LEAP. I believe it's a very good social intervention program that helps to meet the needs of some of our most vulnerable in society. The other question we have to then ask ourselves is, what does that also mean? The numbers that we are seeing, what is the reality that is facing us in terms of the way we design and implement our social policies to help the most vulnerable in society, so that at least we can continue to make efforts towards really reducing the incidence of poverty. Because again, for me, it's about the basic human needs that everyone has to try and address on a daily basis. What I can eat, the medical care that I can get, water that I can drink, food that I can eat, and then a little cash income to ensure that I can take care of my family, and other relatives. So we really need to keep examining our economic and social policies and what it is doing or not doing for the most vulnerable, which is, 8 million plus another 6 is not a small number to have in your society as being vulnerable.
And if you add the 8 million to the 6.5 million that are threatened by multidimensional poverty, that gives you practically half of our population. You're inching towards around 47% of the population, which is stark. But let me find out whether Dr. Saad Idrisu is with us now. Dr. Idrisu, can you hear me?
Yes, good morning, Ben, and good morning to all your listeners.
It's good to finally hear from you. You've seen the figures, 8 million in multidimensional poverty, 6.5 million also on the very cusp, on the precipice of getting into multidimensional poverty. But when you look at the period, the last 7-year period that it contemplates, between 2011 and 2018, you would realize that the incidence and severity of multidimensional poverty, or poverty generally, have reduced across the country. That being said, we also have the SDGs on the other side and its own requirements when it comes to the reduction of poverty or eradication of same, if that is even a possibility. And the window is between now and 2030. What do you make of where we find ourselves and realistically where we could find ourselves in 2030? As of this point, we're already in 2023, 7 years to go.
Thank you again, Ben, and good morning again to all your listeners. Well, if you look at the UNDP report, it's actually a bit concerned to all Ghanaians, especially if you look at with 8-point-something million being in multidimensional poverty. And again, if you look at the data from 2020 onwards, even though there has been a a bit of decline, but I still think we aren't we aren't doing much. Again, if you look at the 6.5 million that are also vulnerable to, multidimensional poverty, it tells you that we are looking beyond just 8 million thereabout. And again, Ben, there's something that we must focus on. That is the entire report. Looking at what goes into the report, it will help us to understand this whole discussion in general. If you look at the UNDP report, their focus is basically on the 3 dimensions, which is health, education, and living standard. And based on these 3 dimensions, they have broken it down to 10 indicators, which is, if you come to health, then you are looking at nutrition and child mortality. If you come to education, you are looking at years of schooling and also the school attendance. Then the living standard, which is much more of a concern too, because with the living standard, you are looking at cooking fuel, you are looking at sanitation, that is in terms of toiletry facilities, whether the people share toilets and all that. You are looking at drinking water, how many distance does it take someone to get drinking water and back? That is clean drinking water. Again, you are looking at electricity. Do individuals have constant supply to electricity? Housing, which is in terms of affordable housing. What are the living conditions? Do they have decent housing that they, to live in? Then again, you come to access in terms of like basic mobile phones. Do people have basic cell phones? Do people have basic fridge in their homes or basic, amenities that you can think of? So you are not looking at maybe access like just building houses or having cars or stuff. I mean, motorbikes or bicycles are part of this access. So if you look at this in that dimension, then you begin to realize that people who even earn good salaries in Ghana are poor, basically, because they are poor not in terms of monetary poverty, where the World Bank defines the extreme poverty with the $2.15 a day mark, but they are poor based on this definition of the multidimensional poverty. So the whole UNDP report is like a complement to the standard that the World Bank is using in terms of monetary poverty. Because you could be making more than the $2 per day, but you still find yourself in extreme poverty or in extreme multidimensional poverty, as this report is suggested. And then if you take each of them, you realize that as a country, believe me, we are one of the luckiest in Africa to have poverty alleviation programs. But come to think of it, the implementation has always been a problem in Ghana. It's not like we don't have the good policies to address the challenges of poverty, but the way we implement it, coupled with our political atmosphere, it turns everything into politics and shifts the benefits away from the people that actually need it. Ben, let's come to LEAP, for example, which is the Livelihood Empowerment Against Poverty. It's a very beautiful program in the country, but you ask yourself, what is the criteria for application? Just before this interview, yesterday, I did so much research. I went to LEAP website to see if I have my grandmother, if you have your grandmother or whoever, or if you have people within our community that we know they fall within this extreme poverty line, how can we assist them to get LEAP? There is no online application. How do you run a program whereby probably the whole concept is like there's lack of transparency in that? So can we be sure that those who are on the program are actually those who need to benefit? Because for all you know, this may be hijacked by political contractors, either at the district level or the constituency level, where the constituency chairman or whoever is in charge will have to determine who gets to qualify and who doesn't. So we cannot run poverty alleviation programs in lack of transparency. It doesn't work that way. If you come to the US like this, there are laid down process whereby people could qualify for bridge card. That is, available assistance for the poor and all that. They are laid down procedures. You don't need to go to anybody to plead them to add you onto any program. You go online, you apply it based on the income qualification. If you meet it, the government will send you your stuff right away. So these are the stuff that we need to really look at as a country. Again, come to number 2, National Health Insurance Scheme. We have a beautiful program that could address the health needs, that could address child mortality. But do we really implement it? Are we focusing on that? We don't. We have used politics to cover the NHIS to the point that it is collapsing. But because of politics, we don't want to say it is collapsing. Government is not even pushing in the needed resources into national health insurance. If you take it to any hospitals today, believe me, they will reject it unless you do cash and carry. But it's a beautiful program that could have helped people out of this multidimensional poverty situation that we are talking of. Look at the school feeding program.
Yeah, you can. So I was just making the point that while all you're saying is right, there are also some gains. I think some 1 billion Ghana cedis paid to suppliers also. I took that story just yesterday. There are some gains that are being made in the National Health Insurance Scheme, though I admit in some places you go and you would probably, I don't even remember the last time I used my National Health Insurance card because
exactly.
I mean, I can't even remember the last time.
So imagine people in the rural areas who solely depend on the NHIS. That is the whole point. We, those in the city, probably you have money to pay. But those in rural areas where this multidimensional poverty really takes a chunk of it. You understand? So that is stuff that we need to look at. Again, come to the school feeding program. This is also a beautiful policy that could have addressed the nutritional challenge that these kids are facing, and also the child mortality situation. But what do we see in our school feeding program? It has actually become a death track. Death track in such a way that if you see the food that are being prepared for the kids, believe me, you and I will not even want to eat it. You will not even want your child to eat it. But don't forget that the whole purpose of the school feeding program was put in place to provide the nutritional aspect that children in rural areas may lack from their home meals. So that if they come to school, they could get to eat the egg, they could get to eat the fish, and they could get to eat the good food that will improve their nutritional standard and help towards their growth. Because don't forget that if you look at the whole report, stagnant growth is part of multidimensional poverty. So if we have a beautiful program like the school feeding program that we could have put in place to support nutrition of the children, we shouldn't play politics with it. Right now, parties have hijacked it. It has become like a consolidation to party women or party women and stuff like that. Each time there's a change in government, you may have one person control about 10 schools, about 5 schools. How do we get the effectiveness that we desire? You understand? So if you take a look at the whole country, we have proper policies in place that could have addressed poverty alleviation, but the way we implement them. Again, go to the living standard in the report. Housing is a critical factor.
Right.
We have beautiful housing policies, like the affordable housing policies that we have in Ghana. Kufuor did some, came with affordable housing. Rawlings did some. You understand? John Mahama did some. Segelme is a typical example. Look at what is happening to Segelme. It's been locked down. People that could have access to it, it's been locked down, all because of politics. So if you take a look at the entire country, much of the situation we are facing is due to leadership.
So are you saying a lot of, yes, COVID-19 may have had, and just briefly on this because I want to bring in Alexis Derry. So are you saying that while COVID-19, the Russo-Ukrainian war may have had their impact, a large chunk of our multidimensional situation is actually self-inflicted? Is that what you're saying?
It's purely self-inflicted. And let me even bring your attention to the fact that the data that is even out, it doesn't even cover COVID yet. So believe me, if it doesn't even cover COVID yet. Yeah. It starts from 2014 all the way to 2018. Yeah. So if COVID is even applied, if the data gets updated, let's say by next year, the 8 million we are seeing, it might even probably go to 15 million.
And that was the exact point I was making, because at a point, the GSS made mention of the fact that I think there was another report that mentioned about 2 point something to 3 million had slipped into multidimensional poverty on the back of COVID-19 and the Russia-Ukraine war.
Exactly.
So if you add the numbers, of course, there also is that fluidity, because there may be some who have been in the bracket, who have moved out of the bracket, and others who may be coming back into that bracket, and others who are new people coming into the bracket. So all of those dynamics are there. But just hold for me, Dr. Idrisu. Let me bring in Alexis Derry, Executive Director, Center for Development Initiatives, and Vice President, Ghana Association of Social Workers. Mr. Derry, a very good morning to you. Hello, Mr. Derry. All right, so while we try to get Mr. Derry on the connection, can you hear me, Mr. Derry?
I can hear you. Are you okay?
Yes, I can hear you now.
Okay.
So per the report, we look at why multidimensional poverty? What is it even? It talks about the many overlapping deprivations that poor people experience. We're talking about lack of education, poor health and nutrition, ramshackle housing, and we see a lot of that in our slums. I don't want to use the other word because people may say I'm being stereotypical. Unsafe water and disadvantages to a meaningful standard of life, just in a nutshell. And then we have the Sustainable Development Goals, especially Goal 1, which talks about bringing an end to poverty. The timeline is 2030. We're already in 2023, and the dynamics do not look very good as far as Ghana is concerned. If you look at the data as well, you would see that some of the matters that Dr. Idrisu spoke of, health insurance coverage, undernutrition, school lag, and households with members without any educational qualification is stark. What is your reflection on this latest data, and what does it mean for us in terms of our social structures?
Thank you very much for the opportunity again, and I just also want to appreciate the submission by my colleagues. I took a very thorough look at the report last night and today, and while reading it over and over, really comes to my mind the fact that, like the previous speaker illustrated, policies, but many a time implementation has always been our challenge. But then,
hello, Mr. Derry. The connection doesn't appear to be good at all. Can you move a bit?
Now? Is it better?
It is better. Please go ahead.
Very good. I was saying that the submission by my previous the previous speakers are on point, and I will not want to go into those ones. But just to say that in terms of the social protection that my brother talked about, most of the concerns he raised are very, very legitimate. But I also want to add that as a practitioner and someone who have had a lot of readings and practice and then training on the area, our program has improved significantly. He talked about the line application and all that, which is something that maybe I think the lead managers are listening. They will probably think about bringing it on board. But over the years, it has become very transparent, looking at the community structures that are involved in terms of ministering of the service itself, to the extent that sometimes payments are done in the chief house, and the community register is known to many other people. So, of course, there will always be room for improvement. But having said that, I've looked at the entire report, and you see, many a time, we look at the policy, but we don't look at the implementation. And if you look at the introductory note to the report itself, it said, and I quote, collecting good data is one of the most powerful tools to end extreme poverty. End of quote. It is my humble suggestion that translating good data into services, policies, programs, is also one of the ways to go. It is not enough to have these data turn out, and I must comment UNDP is one of the few institutions that development practitioners like us look up to when it comes to policy data when it comes to all the information that we need to inform policy and practice. Mind you, practice informs policy, and policy informs practice. All the interventions that we have in terms of social justice, we won't just talk about the policy, but we don't talk about the implemented. Look, I think I have repeatedly turned out these statistics, and now I'm becoming too fed up. To the extent that if we talk about the social worker ratio, the population of Ghana, we have only one government of Ghana social worker officer to a population of 34,000. In South Africa, it is 1:6,900. Uganda has 1:2,900. And Ghana is one of the few countries that every social legislation we put a responsibility on the social worker. But nobody turns to ask what is their human resource strength? What is the budgetary allocation meant for them to be able to translate these services, these policy services? And for me, that is worrying, that we need to take a second look. But the place that is of importance to me when I look at the data is the issue of childhood poverty. And where, if you look at page 9, where the figure is 566 million, that to me is not surprising because I have done a lot of work and done a lot of reading. And globally, at the time we were doing some work, the figure was 560 million children live in extreme poverty and vulnerable to so many factors that will militate against their survival and development. So this 566, which of course does not include the 2019-20 and this, so it means that our figure or the figure we are working with relative to the global childhood poverty of 570 million is something that is also of worrying to some of us as people who are actually dealing with the bread and butter issues of the vulnerable. So yes, we as a country, we've made some progress
in
some of the areas. There's no doubt about that. Sometimes we can lament over our problems to forget about our mercy. So it is true that we have remain to be. I said I don't want to go into the data and all that. My previous speakers have brilliantly done all those kind of things and all that. Let me just address how we can all together, or what this means to us, and then what can be done relative to this. So, if you ask me, we have not done enough.
We're losing you again, Mr. Derry. We are losing you again.
We have not done enough to bring on board the faith-based of. And we have a critical way in all this work because poverty reduction strategies and poverty itself is multifaceted. So if you take, for example, the Christian Council, the Ghana Pentecostal Council, and the Muslim Federation, if they as groups decide that we will be intentional and pick up a social intervention on our own, take for example investing in women, families and children resilience initiative. Can you imagine the number of contributions that we'll be making relative to all the the areas that have been investigated and interrogated by this report? That for me is something that we should be looking at. So for instance, if you take Ghana from the data they've turned out, there's been some significant reduction and all that. But mind you, that those reductions are meaningless because of the growing incidents that we are still having. And again, it's about even urban poverty. We don't even talk about urban poverty any longer. We talk about poverty as if it is only in the rural areas.
And that's a valid point you make, which I'm going to be throwing to Dr. Osai Kwapong now. A few issues to contemplate. So when you look at the report, we've always measured poverty using a monetary metric. But the latest MPI captures the overlapping deprivations experienced by poor people on three fronts. I'm talking about education, health, and living standards as well. But a bit of a breakdown for you to come in. I'll get to the rural-urban drift, but comparing the incidence of Ghana's multidimensional poverty you see a figure of 45.6%. Then you look at the consumption expenditure poverty, which stands at 23.4%. That's a disparity of 22.2% percentage points. If you look at it, what it means is that 19.3% of the population is both multidimensionally and consumption expenditure poor. Almost 20%, a fifth of our population, is poor on both ends, multidimensional poverty and consumption expenditure poverty. What do you make of that? And then when again you look at the fact that the rural-urban differences, you have 64.6% of the rural population, 27% of the urban population being multidimensionally poor. What does it say of our society?
Right. So I think you're correct that we cannot look, at poverty with a sole focus on, the monetary side of things, right? So that's why, for example, it's important that these other indicators are also used in measuring the extent to which individuals and households, families are experiencing poverty, right? School attendance, the nutrition issues, the living standards, access to, even toilet facilities, etc., etc. All of those things combine to contribute to one's state of poverty. Because you could even have the cash income, but if you have the cash income and, for example, you can't access adequate quality health care, then you're still either poor or vulnerable to situations of poverty. The different angles from which this is being, measured to give us a sense of how the dynamics of poverty is working is that, for me, it has real policy implications for those who design policies and programs to address poverty, which means that you can't just have a one-size-fits-all to say, okay, we have a problem with poverty, therefore, if you implement policy A, we would get rid of poverty, or we would significantly reduce the incidence of poverty. Then, for me, the utility of these reports is to say to us, okay, if we take the nutrition piece of it, what actual policies and programs can we come up with that addresses the nutrition side of the poverty equation? If it's a school attendance issue, then what sort of educational policies and practices do we want to put in place to address school attendance? If it's a cash income challenge, if it's an access to quality health care, so that you would have to come up with a myriad of policies properly implemented is what would then, its cumulative effect is what would allow us to also address poverty in its disaggregated dimensions, but also the overall poverty picture.
Coming to you, Dr. Idrisu, what would you say about the rural-urban situation when it comes to poverty and what it reflects for you?
Well, that's why initially I already said that we tend to focus much more on the rural area. But believe me, right now, what is going on within our urban areas, people are much even more in extreme poverty and multidimensional poverty, in the sense that when you shift away from the monetary measurement, just the World Bank $2 per day measurement, then you realize that you can even be making so much, but you still be in the extreme poverty. Why? Because your housing needs are not being met. Ben, look at how much tenants pay as rent advance in Ghana. How much of your salary could afford that? So you will end up having to go for loans to be able to pay for such rent advance. But yet we have governments upon government coming in and doing nothing about it. It's like it's normal. If you go to any other country, let me just say America, you will never find a landlord asking you to pay 2 years rent advance, 1 year rent advance. That is so ridiculous. How much is your salary that you have to cough up such things? So you are going to end up going for loans, paying interest on those loans. How will you be able to get out of this poverty situation? So policymakers really need to bring their attention onto the daily bread and butter issues that both urban and rural areas face.
Right. And that's a crucial point you've made there.
Very, very crucial.
Just one thing you've mentioned, but rent, for example, and housing. So housing poverty, if you like, and what people have to go through. The fact that we've not been able to regulate the system, even if it were, there's only one place I have seen. It's a sort of hostel. So people, well, two places. One in the Nkrumah Circle area, another one in Jowulu, where people can, for a week or even for a day or for a month, so there's a facility and you can go and pay, or whether 6 months. But in most housing units, 90, maybe 7+% of them, you have to cough up 1 year, 2 year, and these are not cheap. So that contributes a lot to the poverty scheme that we have in the country. But gentlemen, to wrap up the conversation, I know you want to come in, but I'll give each one of you a minute because we're on a time leash. When you look at the purpose and the use of this MPI, you would find out that the purpose is to monitor key simultaneous disadvantages that affect multidimensionally poor people. So monitoring. In terms of the use, we're hoping, one of them, to develop the purpose of providing clearer guidance in designing programs to reduce poverty. My question to you, gentlemen, 1 minute each. How do we get to this end ahead of 2030? I'll come back to you, Dr. Idrisu, since you wanted to make a point.
I think to be able to get out of these extreme poverty scenarios, I would say that governments, not just MPP, but any government at all from now to 2030, we should focus on 5 major stuff. Believe me, both rural and urban Ghana, whenever people take their salaries, these are the 5 major stuff that they spend on. Rent, which I already talked about, food, which is something we must work on. You don't have to go to market and they'll be counting tomatoes for you. $5, 5 cedi tomatoes, then you've been counted 5. We don't have to get to that. Transportation, governments have to work on that. We have to liaise with the local union to be able to put in proper public transport system. Those are the stuff that help within the advanced world. That you could get a bus, you could get a train, you understand. You could go for Section 8, which is the affordable rent system. You get it. Schools and medical bills, that is where most people spend on. We should design policies that will be able to absorb some of these parts responsibilities on the citizen. Then we have utility bills. So these 5 key areas, these are the major drain on the Ghanaian public or the Ghanaian consumer, basically.
All right.
Phone bill, that is internet, data, you understand, water bill, light bill. If we could have subsidies in this direction, at least people will be able to live better off. If we are able to shift away from politics and make good use of all the affordable housing programs that we have, people will be able to make good use.
Okay. Dr. Idrisu, you've gone way beyond your minute. We're on a time leash. But thank you very much. I don't know, though, Dr. Osai-Kwapong, what you think about the subsidies, because we've tried subsidies on electricity in the past. We had to let go of it. Nigeria has let go of its fuel subsidies. Quick thoughts, Dr. Osai-Kwapong?
Well, I think we still have to keep trying, right? We have to continue to engage all of the stakeholders who are involved in addressing issues of poverty, both from those, the policy makers, as well as the practitioners, academicians who also study these things, produce all of these kinds of reports. I think that it's not an easy task to address, but also the implications of growing poverty and some of the instability issues that can emerge from a growing population that is very vulnerable to poverty says to me that we have to continue at it. We have to keep putting our best efforts forward, and keep trying the very best that we can to really reduce the incidence of poverty.
And I think we all agree it is policy, 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 and also implementation, implementation, implementation. Mr. Derry, you have the final word.
So we should invest more on some of the areas that I consider as very critical. For example, if you look at the life cycle approach to poverty reduction, investing in families, investing in children at a tender age, daycare centers, access to healthcare. All those approaches, which we normally will refer to as the life cycle approaches to ending poverty, are very important. Then we should also take a second look at our flagship program lead. But among all this, we also need to look more into the people who are tasked, mandated to implement these policies. Are they enough? Are the numbers enough? Are they motivated? Are we supporting them to be able to deliver on their mandate? And I think the media also have a critical role to play, because the media is a powerful tool, and this, what we are doing is advocacy. I was pleasantly surprised when your producer shared the report with me, because it's something I was looking for, which means that the media also have a role to play. You are the people who are giving us the information, and we are using the information to do the necessary advocacy. So the bottom line is that it is about implementation. Implementation can only be triggered effectively and efficiently when the human resources are there. Let's take a more critical look at our social welfare system in terms of the structures, in terms of the human beings that are there to provide. Look, it's so painful that every year we turn out not less than 800 social workers in 5 universities, and less than 1% of them are employed. When the employment opportunity is even available, the office of the head of local government service, for one reason or the other, they don't employ social workers. At this time, everybody working and delivering social services is a social worker. We need to take a second look at this also. Thank you very much.
Thank you, Mr. Derry, for joining the conversation. Very insightful conversation we've had here. Dr. John Osai Kwapong is a CDD fellow. We had Dr. Saad Idrisu, an economist, and of course, Alexis Derry, Executive Director, Center for Development Initiatives, and Vice President, Ghana Association of Social Workers. Now, stay with us. When we return on the AM show, it's a conversation about technology innovation in our world today, which are moving at the speed of light. Businesses must then, to catch up, get the required skills, and those ones will be the winners in this very competitive landscape. With this in mind, and with an eye on the future of work in Ghana, the Ghana Skills Development Fund was instituted to give grants for training and development for over 700 businesses in the private sector over a period of 5 years. We've got this on our plate. Do stay with us. We'll be right back.